So, like, we'll go through this case of repeated implantation failure. So, this was a 39-year-old lady who had three IVF cycles and four IUI cycles, a total of eight blastocysts replaced, negative pregnancy test, an AMH of 14.9 pmol, thyroid normal, semen analysis normal, hysteroscopy normal, tubes normal. After third cycle, hysteroscopy was done, and that was normal. And the endometrial scratch was done, and there was no pregnancy. So, what we do? We said, let's change and see what science has to offer. So, we did a new treatment. We used a milder protocol. We got 9 eggs. We gave a dual trigger, which is using HCG and analog trigger. We had 7 fertilized and 5 blastocysts. We did a genetic screening of embryos, and we looked at the endometrial receptivity assay, followed by a rebiopsy, and did a frozen transfer. So when we looked at it, there were 3 embryos that came back genetically normal. And that is also important because that gives us an idea that 2 embryos need not be replaced. Now, with so many failed cycles, we decided to go ahead and do the endometrial trio test. And what is that? It's a test that tells us one about the implantation window. Second, it tells us about endometrial health. And third, it tells us about any infection in the endometrium. How good is this research? I'll say very limited. And I think using it in routine cases is not advised. Though in these cases, after having had 3 failed stimulation cycles, I think we were struggling to find if we could add any further information. So we did get a pre-receptive endometrium, which means that in that protocol, the implantation window was different to the normal practice. And that is again important. And in these cases, it's my personal opinion that in these selected cases where with multiple failed cycles of treatment, and in these failed multiple cycles, you are able to change the results if you are able to get some identifying factor. We also saw that the lactobacillus levels were low, and giving that treatment along with treating of infection helped to change the chance of success. Finally, we achieved a viable 12-week pregnancy. We looked at the multiple causes of implantation failure and had a good idea about it. We looked at the sperm DNA fragmentation rate. We looked at the age, egg quality, and uterine abnormalities. If you see what is the commonest reasons why embryos fail to implant, there's no doubt it's genetics. And even though the regulators are not very clear on offering it to everyone, there's no doubt that at least it tells you which embryos you should not implant. Again, I've given a diagram that tells you that either the embryo is abnormal, and it's a simple diagram, or it is the talk between the embryo and the endometrium, and that's immunology. There's something wrong with the endometrium, and that could be due to a low progesterone level. It could be due to a wrong implantation window. It could be due to a lower chance of a thin endometrium. And there are multiple factors. So if you are able to divide it and strategically look at multiple reasons why embryos fail to implant, you'll get an idea why some embryos may not be implanting, and that analyzing the cause in a very structured manner may help you to achieve a pregnancy. Now, this is for a woman who had been through multiple failed treatment cycles, and we had to do something that is different.